Well, I just noticed that this year in particular that I didn't have a lot of extra energy. It was like all I could do just to drag myself into work, and I got to the point where I couldn't express myself. I would try to say something. I would think the words, but I just couldn't say them.
Patricia came in with fairly vague symptoms of confusion and headache and just not feeling right.
I was talking to my daughter on the phone that afternoon, and she was just very concerned. She said, "Mom, you have got to go to the doctor and find out what's going on." And they started running some tests, and it was when they ran the CAT scan that the nurse came out and informed me that I had this brain tumor, and they were admitting me.
The difficulty of taking out a brain tumor really has to do with a couple of things. The big one is where it is in the brain and how eloquent or how important that brain is that's around it.
I mean, it's pretty scary when you don't know if it's malignant or not. And my two girls lost their father Christmas Day, this past Christmas Day, to a tumor that was inoperable, and he fought the cancer for 2 years. And I watched him go through it, and I really couldn't see myself doing that. I didn't think I would be a strong enough person to go through it, but I'm so glad that I didn't have to, and all our prayers were answered.
Patricia's tumor almost came up to the surface, and it was not in a particularly high rent place of the brain, and we were able to resect it. Today, Patricia is doing very well. I saw her just recently, and she is thrilled about how well she's doing, and she's back at work, and as best as I can tell, she doesn't have any deficits.
Immediately after my surgery, I knew my brain was functioning correctly because my thoughts were clear. When I went to say something, it came out. And it wasn't that way before the surgery at all.